Hey, welcome to Fabrocini Sports Medicine. Today I'm here with Sara, one of our trainers at the club, and she and I are going to talk a little bit about the low back and injuries to the low back. Sara, as fit as she is, has had a series of low back injuries to the sacroiliac joint, to the low back, the disc. She's had an MRI recently. Why don't you tell me a little bit about your history of how some of your back problems occurred, Sara?
Apparently it's been coming from a lot of kickboxing over the years, teaching kickboxing, teaching body pump, ski conditioning, obviously snowboarding, and dirt biking. So just over the years, a lot of impact, a lot of twisting, a lot of rotation, and like you say, sometimes even when you're fit, you compensate because you're strong, but then you do the wrong form and
twist torque. Yeah, she just recently, because her pain was so bad, she had a flare-up after a kickboxing class or several classes, and we actually had an epidural injection with a pain doctor locally and an MRI, and the MRI showed, sure enough as we thought, a disc injury. It showed a protrusion and the annular tear, which we'll talk about in another YouTube, but basically her discs were involved. So, Sara, why don't you just show them, she teaches body pump, some of the things some of these repetitive flexion cycles that you do in body pump. Yeah.
deadlifts.
And again, it's all about proper mechanics. But what can happen as things fatigue is going into some poor form here. You start to round the low back with load, and you do it over and over, these thousands of repetitive flexion cycles. The other thing is repetitive rotation cycles, and Sara being a boxing instructor, why don't you face this way? And again, she has good technique for the most part, but again, you can visualize when she fatigues or starts to go aggressively fast, you get all this twisting in the low back, which can wear and tear. Just visualize your vertebrae doing this. Anything in between is going to grind on the disc. Now, I'm going to lead into a machine that's commonly used in the gym, why you should use this machine. Sure, go ahead, get up there and demonstrate. And we're going to look at Sara's low back. Okay, now she's going to run through a few cycles, what we typically see in the gym with this. And she's going to go all the way through, and you're going to see the rotation when you use this machine, because her shoulders are locked in, is all in the low back. Okay, she's going to demonstrate a few cycles. And again, it's all twisting the low back. Now, if you take a spine model out, each vertebral segment in the lumbar spine has about 3 degrees of rotation. This machine takes you through a lot more twisting and torquing than that. And that load, when you rotate like that excessively, look in the front here, you just grind away at these structures between the vertebrae called the disc. And that leads to a rip or a tear. This machine is not indicated. A lot of things I don't like about this machine. One, look at where her hips are. They're flexed. So as soon as you flex your hips, that instantly starts to round your back. So she's in a bad position. Her hips should be lower. 2, the rotation while her hips are flexed is almost like bump skiing and twisting, which is why we see so many injuries with skiers. Do that one more time, Sara. Now, if you're going to use this machine at all, what I'd recommend is, and I don't recommend don't use it, but if you do, don't go through a long amplitude of motion. What she's going to do here is just stay forward. See, now she's perfectly straight. She's engaging her lats by depressing her shoulder blades. She's tensing her abdominals. Now she's straight and stiff. You can use this just as an isometric machine, or just very small pulses. Now she can get some good muscle contraction without that excessive rotation in her low back. And that's really what we're trying to teach with people with low back pain. So it's much harder, right?
Yeah.
Yeah, the isometric is developing good muscle firing patterns without all that rotation and hinging. So we'll talk more about these in other segments, but it's a good start for you to work on.